Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another exciting episode, slightly different episode this time. My name is David Ross with the Mental Health and Recovery Board. With me in studio is the one, the only, Alyse Schrader.
Good morning.
Welcome, Alyse. So I say audience a little bit different because Alyse and I are going to be talking about some substance use issues that are in the news that I think there's a lot of confusion about Alyse, which is why Alyse is here, because she's an expert. She knows. So we're going to talk a little bit about Drug Take Back Day. We're going to talk about something called kratom, and then something that I had to practice, Alyse, to pronounce, medetomidine. Can you believe that, audience? Medetomidine. You know who would be happy? Tanya Mounts at the hospital, UH Samaritan, our pharmacist. She's on our SUD committee. She was on our board for many, many years. Tanya always makes fun of me when I mangle words. So I practice. But these three issues are pretty prominent, so I thought we should give them a little bit of time. Obviously, we always include some follow-up information in the program description, so I'll encourage the audience to look at that. But maybe we'll start with the easiest one, and it's coming up pretty soon. April 25th is what's called, Alyse, National Drug Take Back Day. So they do this twice a year. I think it's in April and maybe October, something like that.
So. Mm-hmm.
And we've been doing this ever since the opioid crisis got really, really big. And the thinking is, let's get rid of all the extra medications. And there's a lot of reasons why somebody might have extra medications. Maybe somebody in the home didn't take it all. Maybe, unfortunately, they passed away. For a lot of reasons, people have a lot of unused extra, if you will, medications. And some of that stuff is really dangerous. Some of it's very addictive. Mm-hmm. And as I've said to some of the older folks I've talked to about it, when they question why they should do this, I said, you might have your grandkids over and you might trust your grandchild, all right, with your car keys, with your bank account, with your PIN number, Alyse. But their friends, you can't trust their little friends because they'll go through your medicine cabinet. They will look on your counter, and if they see something, particularly something that is an opioid or something else that maybe they think has street value or might produce euphoric effects, they're going to take it. They're going to steal it. So it's best to get rid of them. So these two national days draw attention to the fact that we shouldn't leave these things lying around. And our community at least feels so strongly about this. We purchase permanent drug drop boxes. They're like, they almost look like big mailboxes. Yeah. And we located one down at the sheriff's annex there. If you pull into the parking lot, you might want to go and get some coffee at Tim Hortons, but don't go to Tim Hortons for this illustration. It's right next there. You pull in the driveway, and the coroner's office, you'll see that labeled now on the door. If you walk in to where it says coroner's office, when you pull in the driveway, it's on the right-hand side, first door there on the right. You walk right through those doors, and then you hang a hard left, and the box is right there. And it's accessible now because of our new sheriff. He moved it there because 24/7 people can drop off medications.
I think that's great.
Right?
If you get off work a little bit late, it doesn't matter. You can still swing by and just drop it off.
Drop it off. So the only things they don't take are things like liquids, but pretty much anything else, you don't have to take it out of the bottles. You just drop it off. Get rid of it. Now, we're drawing attention to the day, which coming up on April 25th, which I believe is a Saturday.
Yes.
10 to 2, though, to make it even easier, you can just drive into the sheriff's annex there, and there'll be officers waiting. You don't have to get out of your car. You can just hand them a bag of all the medications, and they will put it in the box for you. So easy peasy, right?
Easier than McDonald's?
Pretty, yes. Yes, I think it is quicker. I think it's quicker.
And it's free.
Yeah, it's free. So please do that. You may not think it's a big deal, but it is a big deal. On average, every time we do one of these, Ashland County, about 200 pounds we collect, like every time we do this on one of these national days. So there's a lot of
That's
unused
a lot of medications.
extras that are lying around out there. So, drug take back day, April 25th. But also remember, we have 2 permanent boxes, one at the sheriff's annex, the other one down in Loudonville at the police station. Now, I was told by some folks down in Loudonville that the box down there is only accessible when the office is open. So I guess that makes sense. So you need to make sure that the office is open down there. The police station is open, but it's right inside there. You can go and drop off if you're down in South County. Okay. Number 2 that we want to talk about, kratom. Why is it, Alyse? Again, if you don't remember, audience, Alyse comes to us working directly with individuals that were struggling with substance use. She worked in a withdrawal management and residential facility in another county that shall not be named. But she's got great experience helping folks. But I just always find it interesting that people look at a tree or a bush and they look on the leaves on that tree or bush and they say, let's eat that. Let's smoke that. What is it about human beings that every leaf that we see that we want to do things with? What's wrong with us?
I think it comes down to a lot of people just have a trauma history or have things. They just want to feel better.
They want to feel better.
So the interesting thing about our brain doesn't seek drugs or alcohol. Our brains really seek relief.
Yeah.
So people are trying to find relief from something. The thing about kratom is it is really advertised as kind of this blanket magical medication, if you will, weight loss, sleep issues, pain issues. If you're already addicted to a substance, you can use that kratom to help.
Yeah.
But the reality is it's not regulated. It's not evidence-based.
Right.
And anything that has those really strong blanket statements is kind of scary because how can one thing really fix everything?
Right.
It's not realistic.
Usually, I've never encountered the magic bullet pill, right?
Yes.
That does all those things that you're describing.
Yeah, so kratom, it comes in a pill form, liquid, gummies.
Oh, wow.
Oftentimes beautifully packaged, looks very natural. They really advertise it as a very natural kind of thing.
And they're available at like the truck stops and of course the vape stores, right? I think that's part of the issue, that it's so widely available.
And that's what I've heard from a lot of people is I bought it at the gas station.
Yeah.
I didn't think it was going to be so addictive and ruin my
Like,
life.
how could they possibly sell something that's that addictive at the gas station? And then particularly we're talking about our young people, right? It's not like people were getting carded from buying kratom products at the gas station, as far as I know.
Exactly. Yeah,
So,
it's usually hitting between ages 20s and 30s, kind of in that age range.
So we started to notice it a year or so ago. And again, it was totally unregulated. And again, in fairness, Alyse, you correct me if I'm wrong, but comes from this tree and the leaves on the tree, but there's 2 kinds of it. And this always happens. So there's that natural, if you will, form from the leaves, but then there's the synthetic. And again, I'm trying to put it in layman's terms, but people can take the kratom, the natural form of it, in, again, this is not scientific language, audience, but they can spin it up in the lab and intensify the properties. So I know our governor has passed some things. There's been some articles recently, and that's why I wanted to bring it up to the audience. I know they're hearing about it. If they've not heard about it, they're going to hear about it. But it's really the synthetic kratom they're trying to crack down on. So there probably is a potency difference, I would imagine, between the natural and the synthetic.
Yeah, there's definitely a potency difference. And just like with a lot of things, that the synthetics are scary because we don't know what's in them. We don't know how they're made. They're not regulated.
Yeah.
And it's really hard to know when something has so many chemicals and different things in it, how it's going to react in your brain and in your body.
Yeah. So
when people use kratom, so when they're using it in smaller doses, the synthetics specifically, the small doses are going to have a really stimulating effect, like you had 12 cups of coffee.
Oh, wow.
And you're really jittery and you're moving around.
I forgot to ask you that. So it's considered a stimulant?
So in low doses, it's a stimulant.
Okay.
So people are going to be really they're jittery, their brains are racing. They may not make a whole lot of sense. They come off very energetically. And then the unfortunate part with it being something that's addictive is then our body creates a tolerance, which means we need more and more of it.
Oh.
So as the person is using kratom, becomes addictive, starts using more and more, in those higher doses, it's going to act as an opiate, which means it's going to have that really sedative effect.
Okay.
And the scariest part for me is I worked in drug and alcohol when fentanyl and during the opiate crisis.
Yeah.
So I saw a lot of people really high on fentanyl. When I started seeing people very, very high and intoxicated on kratom, they looked identical. I could not tell the difference. They're just slumped over, slurring words. And then that's the challenge too, is synthetic kratom. Oftentimes they say it can help you get off of opiates. Opiates is the heroin, the fentanyl, the Percocet, those kinds of things.
Right.
Well, perhaps you did stop using opiates, which is great, but now you're addicted to this kratom that's giving you the same effects.
Right. So folks don't necessarily know it's addictive.
Yeah.
That's interesting, audience. In lower doses, what Alyse is saying is it might manifest as a stimulant, increased energy, maybe talking really fast, but in higher doses, it presents, the symptoms are more like an opioid.
Yes, exactly.
Interesting.
Yeah. And then when you're very addicted to kratom, if you decide to stop using it, you're going to have withdrawal symptoms very similar to heroin and fentanyl.
Oh, my goodness.
Which is not a fun process.
Yeah. Now, so some people are still going to say, but David, I'm not using synthetic. I'm just using the all natural it's for wellness. I don't know. The evidence still isn't there for that, though, is it?
No, the evidence isn't there. And we still, whenever you use anything to kind of mask or feel better, the important part from a treatment standpoint is we still need to look at kind of those underlying factors. What's really going on in your life or your brain where you just really feel like you need this relief?
Yeah, that's going back to your first point, which I think the audience would do well to keep in mind. Again, whether we're talking about psychiatric medications or if we're talking about these different drugs, right? What's really going on? So underlying issues is a big thing here at the board that we try to promote. So good point. So I wanted the audience to know there is an effort by our governor, and I think the ban might even go into effect here in May or something. Okay, so it looks like Ohio's not banning the natural, but they are going after synthetic. As best I can understand, they're still trying to figure out what to do with the natural and how to regulate that, but they are looking to ban or have banned the synthetic version. So there you go. Kratom, folks, and we'll add some additional information in the episode description. All right, so last topic for today, and this is we mentioned opioids. We've been, we're part of the substance use advisory group that meets, once a month, and we've noticed it. But because I had to learn how to even say it. I imagine the general audience does not understand what a medetomidine is, and that's medetomidine, medetomidine. It's a powerful veterinary sedative related to xylazine, again, something a lot of people haven't heard of, used in animals to cause sedation, pain relief, muscle relaxation. And here's the key, audience, it's not approved for human use. So what's happened is we've seen in some of these analysis by some of the big labs and some of the folks that have died because of overdose that is getting mixed into the fentanyl. So you mentioned fentanyl, which is already an extremely powerful opioid. People are mixing medetomidine into that. So you might imagine that there's even more overdose. The overdose risk goes way up. And again, you had mentioned this with the high levels of synthetic kratom, but, it increases overdose because extreme sedation, it can cause unconsciousness, very slow breathing, right? Low heart rate, low blood pressure, although I need my blood pressure to be lower, higher chance of fatal overdose, longer or more complicated overdose events. So you had mentioned some of your previous work. I mean, have you seen some of those symptoms just strictly with opioids? So some of that slowed breathing, sometimes I know from time to time you may have even had some folks in an emergency situation. So does that all seem accurate in terms of some of the symptoms folks might see?
Absolutely.
Okay.
Yeah. Severe, significant sedation.
Oh,
so
boy.
slurring words or not even speaking at all.
Yeah.
The eyes get really droopy.
Okay.
And a lot of times they're just kind of slumped over.
Now, we've been training folks, and we're doing pretty good, but we need to do better, audience, with the naloxone or the Narcan, the nasal spray. We've been distributing that. really pretty early on when the opioid crisis hit, and the idea is temporarily it can knock off those the opioids from the receptors, right? And basically, long story short, it can revive the person who's unconscious, maybe not breathing or not breathing very much, and it can at least temporarily revive them so you can get them into help. Now, what's the trick though with this medetomidine is so powerful, and even the xylazine. What's going to happen if we try to give somebody like that Narcan?
Yeah, that's a great question. So xylazine, medetomidine, those are not going to respond to Narcan, but it's still important if somebody, you believe somebody's experiencing an overdose, you still want to use Narcan on that person because it'll still knock the fentanyl and the opiate off of those brain receptors and they should come back. It won't do anything with the xylazine or medetomidine, but that's okay.
Yeah. Is that because it's binding so strongly that the...
No, it's not the same chemical or substance. So it's not sitting on those same brain receptors that Narcan's knocking off.
Oh, so maybe we need a new Narcan that knocks those off.
We need all kinds of Narcan, yes. And we love Narcan, and something so important to know.
It's a lifesaver. It has in this county. I know many, many stories,
Even if you aren't positive somebody's having an overdose episode, even if you use Narcan and the person's not even using drugs at all, it's not going to hurt them.
Yeah.
So it's always a great
So really low risk. And again, audience, health department, Acada, Appleseed, these are easy places to get Narcan here in the county, no charge. They'll show you how to use it. You get a couple doses of the nasal spray. Again, not a shot. You don't have to use any needles. You can just push, the nasal spray up into the person's nose, and that's it. Have you had a chance to use that in your previous life?
It is very, in my previous life, yes, it is very easy to use.
Right.
Very similar to a nasal spray if you have some allergies.
Right, that's true. Well, what about the withdrawal? When I was doing show prep, it said the withdrawal can really be severe from somebody coming off fentanyl that has been contaminated with the medetomidine. So, I mean, we already know opioid withdrawals tends to be, aches, nausea, diarrhea, sweating, agitation, blah, blah, blah. So I guess it just makes it worse.
It essentially just makes it worse. It doubles down on those symptoms.
Well, maybe remind folks, because this really is your wheelhouse, if somebody were needing withdrawal management, detox, sometimes it's called, what's that process look like for somebody that maybe, let's pick the opioids, and maybe an opioid that's got mixed with medetomidine. What's a typical treatment course look like for withdrawal management?
So typically if somebody goes into a residential withdrawal management facility, they're going to see a nurse and a doctor within probably just a few hours of getting there. And they're going to be started on medications very quickly that's really going to help ease those withdrawal symptoms and make it more bearable. So that is why it's so important to go into a facility for that withdrawal. Oftentimes when somebody's severely addicted to substances, there's other parts of their health that perhaps they're not taking care of. They're not eating well. They're not sleeping well. All of those things. So that's why going into an actual withdrawal management or detox facility is so important, because you can get a solid 7 to 10 days of being with medical and therapeutic professionals to really help you get off the substance and just get back on track, get back on your feet.
Yeah. Alyse, you're a little bit younger than I. Did you ever see the movie Trainspotting about heroin addiction?
No. Should I add it to my list?
Add it to the
Okay.
No, there's a horrible scene but old school withdrawal management was they locked their buddy into a bare room with a mattress, a bottle of water, and a bucket. And left him for about 3 or 4 days. And of course, the movie depicts it. But a lot of folks, before we did kind of the medically supervised, a lot of people did try to detox on their own. And it's pretty brutal.
Very, very brutal. Yes. If you think of like the worst flu you've ever had, or if you had COVID really bad where you're just having all of the symptoms, it's that. And the other piece to it is if you were to use fentanyl, just even a small amount, it would immediately make you feel better. So there's that piece too, where if you're in a residential facility, you don't have access to that.
Right.
because somebody might want to get off the substance so badly, but then they start feeling so sick.
Yeah.
They just want to feel better.
Do you think having the medetomidine maybe mixed with the fentanyl, will that maybe prolong their stay in withdrawal management?
Potentially,
Okay.
and potentially they may need stronger withdrawal protocols or maybe some additional medications to help offset some of those symptoms.
Well, bottom line on this one, medetomidine is an animal sedative, audience, animal sedative. You don't want to use animal products showing up in the street fentanyl supply. So it can make overdoses more dangerous and withdrawal more severe. And then standard overdose response is typically call 911. All right. Give the Narcan, give the naloxone, rescue breathing if you're trained to do so. Stay with the person. That's still critical. All that stuff that Alyse said is still critical, even though maybe the Narcan isn't going to do anything about the medetomidine. It will with the fentanyl, so it's still worth giving that and calling for help and get them into a good protocol. So, no, thank you, Alyse. That is very helpful. I did want the audience. I always try to be end on an optimistic note, Alyse. And, remember, audience, the board pays for prevention services K through 12 in all our Ashland County schools. ACADA provides that. And his prevention experts are wonderful, and they really are trying to address all of the issues that go in to why someone might first start experimenting with substances to begin with, because we know if we can keep that experimentation down to zero, ideally they don't, that the better outcomes. And again, I was just at a meeting recently and someone brought up, parents might think, well, it's just vaping. Well, let's not even allow for the vaping, the smoking. That really is, remember when I was younger, they called it a gateway drug. And there really has been a lot of evidence to support once you start on something, then you graduate, if you will, to the next thing. And that next thing is almost always more dangerous, more negative life consequences and physical consequences. So believe it or not, folks, parents, help us out. We've got the preventionists in the schools, but help us out. Don't even say, well, it's just vaping, David. What's the big deal? Don't even get me started about all the parents that are buying the vape pens for their kids and get all upset when the school's confiscated. I'm talking to you, parent. Is this on? I'm talking to you, parent. So don't, support us. It may seem like it's an innocent thing, but it's not. It does tend to lead down this road where the substances they use after the vapes are even more dangerous. Not that the vapes are safe. They're not. So the prevention experts talked about that in our summer episode if you want to listen to that. Don't believe me. Believe our prevention specialists. So, well, that was very helpful, Alyse. Anything else you want to say on any of those three topics before we start to wrap up today?
I don't think so. I think we covered pretty well.
Well, next time we're going to talk about something positive. We're not going to talk about all these opioids and these dangerous things, but it's an important topic. I wanted the audience to hear about it, and it is in the news, audience. You're going to hear about the kratom. If you haven't already, you're going to hear about it, especially with the governor wanting to or did ban the synthetic versions, and then the medetomidine. Nobody's going to be able to pronounce it as well as Alyse and I, so make fun of those people. Okay. And drug take back coming up on the 25th. Please participate in that. You really are saving lives. So Alyse, thank you very much.
Thank you, David.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.